right. As we went live, everyone ran away. So we're just with Buddhi and Attie's coming back. Let's see if this works. There's Buddhi. Okay, Buddhi's going to be interviewing me and Attie today. But Buddhi, before you do that, will you introduce yourself and your academic medical self, please?
Can we put some put the calm line one back?
Yeah, sure.
Or I guess, yeah.
We can do that.
We can do all of it, and you act.
Yeah, where is that one? That one.
Which one is Recovery Connections? That's Lee's one, isn't it?
No, Recovery Connections is the peer-led facility in Middlesbrough, which is run by DOT, which takes people off of the street and gets people off a methadone script, puts them in, houses them, and then brings them back into society. So that's a real harm reduction to complete abstinence-based program.
Okay, wow. Can you put?
How's that? And then pocket rehab is the peer-led support, which is anonymous peer-led by mainly people that have been come out of treatment or are looking to get into treatment with multiple pathways. But basically, it's addicts looking for help. Substance use disordered people. Yeah. And Calm Lion, tell us about Calm Lion, Buddhi, and please brag about your credentials.
Is this recording now?
Yeah, it's recording and streaming. Sorry, bro, we've gone live.
So, shall we introduce everyone?
Yep. Okay.
So, I'm Buddhi Lokuge. Dr. Buddhi Lokuge, co-founder of Calm Lion, and I'm an addiction medical specialist in Newcastle, Australia, and a public health specialist. And I work with a local area health service. But today I'm here to interview David Collins and Attie.
Sorry, Buddhi, I just wanna up the volume there on your credentials, please, because there's something about especially when we talk to families, is credentials matter. So the fact that I know it's difficult, but please. Royal Academy of this and Harvard that, it's important for other professionals as well.
My 20 years in medicine, I've worked in lots of different settings in Afghanistan and in Australia, and in many of those places there was addiction. That was a big part of the work we did. And so my training, I got a master's from Harvard, a PhD from Australian National University, and also two medical specialties, one in addiction medicine. And a lot of what I do, apart from treat patients, is try and prevent addiction and its impacts. I work with a substance use in pregnancy service. I work with mental health and substance use service to try and stop children being removed from families, and also do research with trying to reduce opiate dependent harms in people leaving jail. So that's the background. But one of the things that, and the reason we're having this call with Attie and David is that, you know, we're there at times of crisis with the medical health services, but there's this big journey that people are going on, and there's very little that's easily accessible and ready to pick people up after that acute phase. And I think that's where I got in touch with you, David. I trained as an addiction coach with you in New Zealand, and then also met Attie, and both of you have been helping connect people that are hungry for, alone and struggling with with addiction and at different stages of recovery from childhood adverse events and trauma, and so yeah, we're looking for a way to make this, when people are looking for help, make it accessible in a way that they are likely to want to engage with, and to be there to hold people and provide a support. So that's why I thought it's a good time to interview the two of you. David's the founder and he's been the driving force behind a lot of this recovery work that I'm now also leaning on and using in our work. And then Attie's like how would you call it? Not a first follower, but a student who's passing the master in terms of being really accomplished coach and supporting a lot of people personally, myself and others, that family members and friends that I've sent to Attie and to David. So yeah, I mean, I wanted to talk to you today about the work that I'm struggling with. You know, we see families where children are caught up in addiction, and there's really there's no rights and wrongs, no one's at fault, but it's hard to know who is the client and how to support and be useful in a way that doesn't actually make things worse. And I was curious about both of your knowledge and work in this area. So like I said, I see mothers who are pregnant and might have all kinds of substance use disorders, methamphetamines, opiates, benzodiazepines, alcohol. So there's a lot of harm potentially to the children, and so our service tries to support those mums at that time in the families. And then the next part where we're working with mental health, it's where a child has been flagged by the mandatory reporting as being a child who's at risk of serious harm. And so then the supports are trying to support the family where there may be substance use and mental health issues, and preventing the child that sort of last desperate measure where they're removed from families. And I've seen so many negative consequences to the parents who now have to deal with the loss to the children, and the foster system isn't a panacea. And just on that, actually, one of your students, together with a student who did the coaching with you, David, Nick Price, we're setting up a organization, a non-profit, to try to take children in foster care on respite camps, where we can try and provide them with some coaching. So one of the things we want is all the mentors and the people involved in the camp to be trained in coaching as a way to support. So that's enough about sort of me and the reason for having this call and the reason to be connecting with you two. But I'd like to now, get your experience and wisdom on this on how to support families where substance use is.
Okay. Are you right for me to go first, Attie? Yeah. So on the 5th of March, it was Sam, my son's 25th birthday. And I woke up on his birthday and I said to myself, today I'm going to forgive myself for the fact that he was taken away and put in foster care. Yeah, so my kids were taken away and put in foster care because of my using 25 years ago, and the world has changed a lot since then in moving away from a moral, stigmatized approach to addiction treatment to one of much more the medical model to kind of reduce the harm to try and move someone along. Because most of the people that get impacted by substance use disorder, which is a politically correct name, is not only the person that's using, but all the family members and community and workplace environment that's around it. And so that's the systemic side of it. And as a result of my own kind of healing, my own kind of shame that I actually got to that is what's driven me to do this work. And to be so passionate about this work, because as a kid I swore I would never put my children through what I went through, but I ended up doing a lot worse because I didn't know any other way. So my whole thing was, well, at least I'm not drinking alcohol. Yeah. So me growing up in an alcoholic home, as long as I was doing drugs and not being an alcoholic, then I was way better than what my childhood was. So that was the psychological part of my denial that needed to be broken. And because I was in that state, a lot of people around me suffered, and a lot of people in the medical profession and in the criminal justice world didn't know how to respond to that. Yeah, so it was when HIV was, there was a big HIV outbreak. Methadone was bought in. It was subsidized by the criminal justice system to like, okay, well, we know where all those addicts are. We keep them over there and we medicate them. And the police basically became your drug dealers, and you became addicted. So systemically there was a chemical kind of control, yeah, of the problem, but not necessarily a recovery. So for me, I've spent the most of my time trying to recover my dignity, my self-respect, and to learn the tools of how to be a better father. So I'm very dedicated to coaching, to teaching coaching, and to create a more compassionate system around individuals and their families, so that we can all live happy ever after. So that's my passion around it. Attie?
Thanks, David. Buddhi, what's the question?
The question is, so supporting families, and if clients where they also are parents and there's substance use, and so I work in health services, which are often asked to try and support a family to try and keep the family intact, but there's harms being seen, and there's concerns of the safety of the children, and there can be, I mean, there's a lot of negative publicity about the foster care system, but there are times where I've seen parents who are struggling with their addictions, and they're not looking after themselves, and then and then also struggling to care for their children and keep their children safe. So have you any experience of supporting families like that, and what can we do?
I just want to jump in there quickly as well, because there's a lot of impact that happens to the social workers and people, the carers that are in that system as well. To watch kids being taken away from their families, traumatic for the social worker as well. So it's really not the goodies and the baddies. I just want to get the system to work better. So you as a doctor, I'm sure you're impacted as well. So I just like us, as we interview this stuff, to be aware of all the people that are impacted.
So from my side, if I have to say what do I do, is that especially when it comes to families, is how this impacts me is I have to sit with other people while they're in their pain, and then try to start a conversation by using the coaching modality. And sometimes the conversation just needs to be started and not pushed, in especially in traumatic situations like these, where it's either kids getting taken away or family members die. It's like being able to just sit in that system and feel the tension for everyone else that can't feel it yet. Because what happens in the system is that all the different players get sucked into this one vortex, and none of them can really get outside of that. So as a recovery coach in that space, it's just being there and sitting in the tension with everyone, especially the family members of loved ones that are struggling. And then as the conversation starts, it is obviously uncomfortable, and then the discomfort of the system just comes to the surface. And sometimes people can see it and feel it and start changing it. And sometimes I wouldn't say frustration, but sometimes the pain is that people just don't get there. People don't rise above the chaos to feel the actual tension and impact it has. And for me, there's no way to put my finger on a certain technique or a certain thing that works for people to be able to rise out of it. Different things work for different families, and different approaches work for different people. So I don't know yet if there's a specific way to do it, but as I understand it, it's just to be there and to hold attention for the other players while they still come along.
Can you explain what you mean by holding the tension? So there's crisis. There might be children who are struggling at school, and or there might be health concerns, or there might be absenteeism or risky situations, and but often we're seeing people when there's actually external pressure to come, and so then you're starting off from the back foot, but in those situations, what can external services and coaches do? Attie, so you say hold the tension. What does that look like, and what would a team that has other specific duties, how can they learn from some of the techniques, basically that conversation that you're talking about of holding the tension? Because I think I've palpably seen in myself and in the people I work with is unless you're aware of it and managing it, this need to feel like jumping in, rescuing, and then struggling when the families are not going in the direction you might want to be hoping for,
Yeah. So if I can use a metaphor, in holding the tension, I cross the bridge to the other side and completely try and view the world through the client's eyes, and then just tell them what I hear them saying, or I tell them what I see. Because sometimes it's just as easy as to name everything that's happening there. And sometimes it's just like to name the feelings. I see there's a lot of resentment here. And just naming something like that to bring it into the conversation will then all of a sudden bring all the tension to the surface. The biggest setup is that people that are around the person that's struggling with substance abuse normally get pulled in because they feel like they can fix it or plaster it or rescue it. And as soon as anybody tries to do that, the culture of addiction sucks them in, because there's no curing this thing and there's no rescuing it. The approach that we like to take is to try and get someone to empower them to start taking responsibility for themselves. So that process in itself is a tough process, because it's easier to just ask everyone else to do things for me than me do it for myself. And the longer I get stuck in the culture of addiction, the more likely I am to have lost my personal responsibility completely.
Sorry about that.
No worries. So it's like, so in our system, the way we teach it, it's like there's a person struggling with substance abuse, then there's loved ones, and then there's a workplace. And if the system is out of balance, which in my case, most of the clients I get, which are family related, is maybe parents that have children suffering with addiction. And then in that case, the system is unbalanced because the parents are the workplace and the family. So they should be giving care and love, but they're also providing finances and a place to stay. So then keeping them accountable and confronting the issues is very difficult if you're also supposed to be the carer and the nurturer. And then the system will play out where the person struggling with substance abuse will manipulate those two boundaries completely. And then that's maybe where enabling starts coming in.
And so, yeah, what's the what support can you offer then the parents in that case to, or David, like Attie, how do you then what are the tools you give the parents to support without enabling?
Well, for me, from my side, there's some teaching and some coaching, and to give them those kind of insights of how this thing operates, where some of the places that they can go to for group support, where some of the places that they can go to for counseling or psychology, if that's what they need. But in this thing, it's just kind of teaching them, bringing the stuff into the light, to confront the issues that everybody's keeping quiet about, to just name them and start the conversation around how are we going to start putting boundaries in place.
It's also very different if it's a single parent family. So if you've got one person that is a caregiver and a provider, which is like a single mother where there's an absent father, is a lot harder than well, it's always hard, but in a family where there's a mother and father that are both together, it's really important to get mum and dad on the same page of what that looks like. So if you can work on getting mum and dad on the same page, and to kind of because what will happen is the illness, for want of a better word, thrives when there's a split. Yeah. So what you're trying to do is get unity around the support. So you've got a nice foundation of support. So me and your dad are going to get on with our lives. This is what support looks like. We will provide care, compassion, and cooperation. But if you're not going to take it, then that's up to you, but we've done our bit. So often working, and those parents don't necessarily have to be together. They can be divorced. Yeah. So often working at the bottom of the pyramid to create a nice foundation and getting some recovery for those two individuals. Yeah, to try and get the mother to detach, for one to be stereotypical here, is like, okay, well, I've done the best I can. My boy's 30 years old now. I actually have to let him go. Yeah, and to get the kind of the father to kind of hold that boundary, but it's very difficult if you're a single mother. Or a single father. Yeah. And what Attie's talking about is the client is whoever's in front of him, sitting with him, bringing to the surface what it's like for that person as they cross that bridge to the other side to a culture of recovery. I thought that was a very nice metaphor for Attie. Because often people say, but I've come here for my son. Tell me what to do to fix him. And then Attie will say, no, that's like, I'm here for you. What's it like in yours? Well, I'm awake all night. I worry. I work so hard and I take my money and I give it to him and I'm left with nothing. And all the other siblings are all upset and we all fight. And they say, Mum, you must just kick him out. And I can't do that. That's my boy. And then Attie will hold that person as they walk across their bridge to like a place that they can feel comfortable with. Would you concur with me, Attie?
Yes, I would, David.
Attie, so just if you've got, have you got any thoughts on how to work with this? Where there's external pressures, so there's a fear of a child being lost, or there's legal consequences. That's another situation where we have clients, but then they're in front of you and there's an opportunity. Any thoughts on how you approach that situation where there might be there is often motivation, but there's also a lot of ambivalence?
So in some cases, moms with small babies don't really want to go into long-term recovery or try recovery in the beginning, because it's always like, I can't leave my baby to go into treatment for X amount of time. And then the conversation kind of just pushes around that same thing. It's like to bring that into the surface is, what type of a mother would you like to be, right? And can you be that mother right now? And what are some of your options to move you forward so that you can be that mother for your child? But when it comes to children, it's always very tricky, especially here in South Africa. It's very, very tricky. And I've thought about this many times. I would have liked to see some places where women, single moms that have babies, are able to go to treatment and have space for their babies to go with them, and maybe it's like a separate kind of a wing. In some workplaces at the moment, there are daycare for single moms that are working, so that they can actually bring their children to their place of work for the day, and it's a daycare, and then go away again. Maybe some initiative like that would be helpful, because there's a lot of single moms out there that really need treatment, that never goes to treatment because there's no one else to take care of the baby.
Are there places like that in Australia, Buddhi?
We have the therapeutic communities where mums and babs can go. Yeah.
You see, that's like when I went across Australia, that's what I found was like Australia has fantastic resources. Yeah. They have lots of recovery capital. But still, to get people to make use of it is a challenge. Yeah. Whereas here in South Africa, we don't have much recovery capital. Yeah. But the problem is I would say similar. But the belief here is we can only get better once a rehab comes. So what we're trying to do with pocket rehab and all this sort of stuff is to create the psychoeducation side of it, to educate more and more people around it and move to the wellness model. Yeah. So how can we make professional people better? Doctors, nurses, psychiatrists, which is what Calm Lion is doing, and how can we help people with lived experience use their past as a profession and become peer support specialists? Because being such a stigma-based illness or condition, on top of all the other stigma-based illnesses. Like addiction is the one that sits at the bottom, where people say, well, you brought it upon yourself. You shouldn't have done that anyway. We told you at school not to take drugs. So when it comes to funding or any sort of, there's so much stigma in the medical world around people with substance abuse. There's so much, like, let's just throw people with mental health in jail. And let's hope the criminal justice system will be able to fix people's mental health problems.
That happens in South Africa, you're saying?
I think that happens globally, and the World Health Organization and what their recommendations are is like the war on drugs since the past kind of 115 years have been abusive, have been wrong. It's actually caused more harm than good. So it's kind of deconstructing that whole institution. This is coming from the World Health Organization, and the United Nations. They're saying we got this wrong. I think it started with the Harrison Act in around 1914, when and it's kind of born in racism. Yeah, so you can imagine what it was like in 1914. First World War, taking children away from their families, taking indigenous children away to educate, to colonize, to raise. It gets. Don't let me get started, because I start foaming at the mouth. Because it's addiction's got nothing to do with the drugs. Everybody has an addiction. It's when that becomes a behavior that continues in spite of the negative consequences. So, for example, alcohol and nicotine are the biggest killers by far, but culturally they're so acceptable. But let's focus on the meth heads or the people taking ice or opiates or something, because they're the tiny minority, those crackheads, and that actually takes away from the huge addiction problem which everyone's feeling, which is that kind of disconnect and isolation. That's like, what is it that you do that brings that instant gratification that alleviates the pain and the isolation of that has turned into an addiction?
Just on that, and maybe to end the discussion, there's talking about families, talking about trying to support families and children, keep families together, supported. One of the things I know I found when I was as a single parent, getting support, there's so many competing demands, and for me, the online world, being coaching with you and Attie has been a real positive. But when I think about the clients that I work with, there seems to be, technology seems to be another thing that there's socioeconomic and I don't know, Zoom seems to, there's also in the online world a sense of exclusivity or stigma, and but is that your experience, and how have you found translating from the in-person work, and then during COVID a lot of things went online, and how are you finding that in terms of being able to support families and clients and busy parents or parents who might be struggling? Attie,
can I jump in? So
yeah.
So the difficult thing, and I guess talking about holding the tension for the family members is this: we can't force anyone to be ready to go into recovery, and nobody knows that specific moment in time when somebody has that aha moment where they decide internally for themselves, I want to change this. And for family members to look at their loved ones going through that pain, trying to force them into change or force them into recovery is frustrating, it's damaging, it's heartbroken. So the kind of an idea is for me to sit with the person that's in front of me and get them to look at themselves and to look at their own self-care and their own self-love. And I guess doing that on Zoom or doing that face-to-face has had the same impact for me. Because when a person comes to sit with me, especially when they come to talk about someone else's problem, and I ask them a simple question as, but how are you today? Then sometimes they just break down and start crying because nobody has asked them that question for so long. Because I know in my experience, my family members would gossip about me and what I'm doing wrong and where am I sleeping and where am I living on the street or whatever the conversation was then. And then they forgot to have a conversation with each other and support each other because everybody was talking about my problem and I wasn't even thinking of any of it. I was just somewhere on the street wanting to score, get high. So to get someone back to just look at themselves and to see that they can find support for themselves has actually got a very bigger impact than we think. Yeah. For someone to hear someone else saying, but I'm here to support you. I understand that there's a lot of other problems, but what can I do for you today, here, right now? And that kind of changed the whole dynamic in the conversation. And I've really find it very easy to move between Zoom and face-to-face. Some clients, some of my clients prefer face-to-face, so it's a little bit more difficult in these times. But mostly what I've seen is that there hasn't been a real difficult in transitioning between the two for me. I think it's been a great tool to be able to reach people a little bit further away from us.
Yeah, definitely. And reach people who would never have had supports, who might be isolated, who might be living in places where there's not the ability to connect with someone like you. What about you, Dave?
Well, I mean, I'm curious about what it's like for you as a doctor working in this, having an understanding of epidemiology, and the one good thing about COVID is it's gotten everyone's had to force themselves to start to communicate via technology, and so it should be quite easy then to transition to this sort of pocket rehab type environment, where people are now kind of the crisis has happened, we've had to adjust. So that's one of the upsides of COVID. Trying to get anyone to address an addiction problem is difficult because everybody has to do some sort of emotional work. Yeah. So whether the user stops using or doesn't stop using, the whole parts of the system have to change. And I think systemically what happens is a whole lot of fear sets in and a whole lot of panic sets in, and it's quickly, let's put the fire out, but there's no continuous fire break being built. So the way that we measure success is keeping people engaged in the process, regardless of whether they're using or not using. So, for example, if a patient keeps coming back to you over a year period, eventually they will get it. But if their first engagement with their doctor is one that is a poor experience, and the patient decides, I'm not going back there, we've lost them. So that's the skill set that we need to be able to type of. I mean, I took my son, we had our first normal kind of weekend this weekend. My son and 3 of his friends came together to live together, spend the night together over the weekend. And then on a Saturday morning, I go to the rehab. And when I was said the kids were going to the rehab, they were all like wide-eyed. It's like, oh my God, we're going to see like drug addicts, you know. And I said, just be careful they don't dribble on you, just as a joke, you know, but to try and ease the tension. But there's so much kind of stigma still and misunderstanding that yeah. So I actually think the online environment is a good environment, and it's engaging the youth at where they're at. Yeah. Like the youth are very comfortable, you know, Instagramming, Facebooking, Zooming, you know, having, and if I listen to my son as they interact, as they kind of play Minecraft, and they're talking to each other through WhatsApp at the same time, you're looking for that. So I think for the youth, emotionally, it's a easy transition. Yeah. I think for the adult generation, it might be a bit harder, but it's working. And I'll always go back to, sorry to babble on, but the word clinic comes from French, and it means place of bedside learning. And that's all a rehab is. You know, the clients come in, they get detoxed, and at their bedside, they learn psychology and they learn how to re-socialize, so that they, like people in rehab, it's easy for them not to use. The challenge is when they leave treatment and they face the outside world. And the outside world needs to adjust. Did that make sense, Doctor?
Thank you. Yeah, Coach, Master Coach, thanks for that. So let's make this a regular conversation. I think there's a lot of really interesting things across continents, and with all this change that's happening, and the pocket rehab, the Calmline UACT work, I think, and Attie, do you want to talk about what you're doing at the moment, Attie, and the platforms you're working with? I know Calmline we're connecting you to clients at Calmline and also coaching.
So through Calmline, I'm working with you and David with the trainings, and then also doing some one-on-one coaching with some of your trainees. And then in my private capacity, I'm working with one business client who wants to start a new branch in the UK. So I'm busy helping them transition and upscale a bit. Then on the addiction fronts, I'm doing a lot of one-on-one work with male businessmen. I don't know, it's just the kind of clients that I'm getting at the moment. And then I'm also running a daily group on Zoom, but that's for pocket rehab. And then we're trying to populate the pocket rehab more. We're also working with another coach in America to start running an outpatient program. That hasn't taken off yet, so we're hoping to get that off before the 1st of April. So that will also then run during the week. So we're trying to populate the Zoom area that we have as much as we can, so that people anywhere, anytime can log onto a wellness group and receive some form of support. whether it's family members or people struggling with addiction.
Which one's that, Attie?
That's for pocket rehab.
Okay, great. All right, Dave. Anything to end with before we go?
Yeah, I just want to honor you, Buddhi, for being a doctor in this field, and being for you and your team on being on that side of the line and dealing with a so-called difficult population. It's really nice to just have somebody, and this wants to bring tears to my eyes, but just somebody that's compassionate and caring, because I promise you, once you've had your kind of kids taken away or whatever, to receive love, care, and compassion in a non-judgmental way is really what's needed. So I want to thank you for that.
Thank you to supported me a lot in personally and in this work. So I'll take my puppy who's starting to get excited and wanting to join the conversation. And see you when I see you.
See you when you see you. Thanks, guys. Thanks, everyone,
Lots
for watching.
of love, guys.
Thanks,